Welcome back. I'm Dr. Yoni Witten, and this is episode 2 of Ask Me Anything. This is a new segment that I'm doing on the Pain Fix Protocol channel where I take your questions about pain, posture, and rehab-related topics, and I answer them long form so that hopefully everyone can benefit from the information that's shared here. Now, I've selected 4 questions for today's episode, and they cover a variety of topics, so let's get straight into it. Question number 1 comes from Lori. She says, "Hello, Dr. Witten. Is there anything that can help to alleviate trigger finger? Could I be doing something to cause it or make it worse? Is there anything to do to prevent trigger finger? I had a trigger thumb about 15 years ago and it went away by itself. I currently have a trigger on my middle finger, parentheses, on my mouse hand. Thank you for any information you can provide." Well, the first thing to understand is what is a trigger finger? The technical name for this condition is a tenosynovitis. And what does that mouthful mean? It means that the sheath that surrounds the tendons here in the palm side of the hand has become inflamed. Now, what's the role of that sheath? It allows the tendons, the long tendons that pass into the fingers, to glide smoothly when we engage in this motion. When it becomes inflamed, you can have swelling, you can even have the formation of nodules, these painful lumps in there that actually hang up and catch on the tendon so that when you try and close your hand, you get painful popping, snapping, or clicking of the fingers. And in extreme circumstances, the fingers or the thumb, as you indicated here, can actually get stuck in a bent position like this. So your questions in reverse order: is there anything to do to prevent trigger finger? Well, there are some known risk factors for trigger finger. Some of them you can do something about, and others you can't, unfortunately. So trigger finger is more common in certain populations. For example, people with diabetes and rheumatoid arthritis and people who have had surgery for carpal tunnel syndrome seem to get this problem more frequently. So do women, probably because the diameter of their fingers is smaller, and so you just have a lot of structures competing for not a lot of space. So they tend to get caught up more often than men do. And then the final risk factor, which is something that we can all do something to influence, or we can do something about, like you say here, is repetitive motion. So repetitive gripping, grasping, or closing of the hand. And I think you were alluding to this when you put "of your mouse hand" in parentheses. So if you're finding that you're mousing a lot and that is affecting that middle finger, you spend a lot of time on the computer, maybe it's part of your job, you may consider switching over to the left hand for a period of time. Because you could very well be contributing to the problem. Switching over to the opposite hand and decreasing or switching up the type of activities that you're involved in on the affected side will definitely help you out. Now, is there anything that you can do to speed up the process, or as you said, alleviate a trigger finger? Yes, I've worked with this condition lots of times in the clinic, and I find that it responds very favorably to treatment. And because it's an inflammatory condition, I like a multi-pronged approach. So I like to hit it with supplementation, where conventional medicine uses corticosteroids for this condition. I really like to hit it with anti-inflammatory substances that are natural. So I love Boswellia serrata for this. I also love 2 proteolytic enzymes, bromelain and serrapeptase, great for bringing down that inflammation and for flushing out swelling and creating more space inside of that sheath for the tendon to pass through. Side note, I've also found bromelain and serrapeptase to be incredibly beneficial for people who have rheumatoid arthritis, which this condition is more commonly seen with. So those 3, super helpful. By the way, all 3 of those can be found in Movement Essentials Joint Relief. If you haven't checked out that formula already, I will put a link for that in the description down below. I also love a couple of physical rehabilitation techniques. Number 1 is percussion therapy. So this is where I would use a percussion device or a handheld massage tool and actually go after the nodule directly. And what you'll find in as little as like 30 seconds to 2 minutes of working on that nodule, don't press so hard that it hurts, just allow the massage tool to do the work. You'll find that the ability to open the hand or the amount of clicking or popping in it should decrease actually very quickly in the first session. 30 seconds to 2 minutes directly on the nodule. The other thing that I really like is notice when I wiggle my finger, you'll see tendons or muscles actually involved all the way down into the forearm. So besides working on the nodule itself, I'll actually trace the tendon and the muscle all the way down and work the entire length of that muscle with the massage tool. And I like to do this for brief periods of time, but multiple times per day. I find that it responds best to that. And then once you've broken up or softened up those nodules and decrease the swelling with the massage tool, I like to go into some gentle stretching where I'll hold the stretch for anywhere from 60 to 90 seconds, and I will engage in that, again, multiple times per day. That's a really good strategy. And the final thing that I love for this is red light therapy. I find that it's super beneficial for decreasing that inflammation, bringing pain down, and increasing range of motion. The other thing that it's fantastic for, and I talked about this in the last episode of Ask Me Anything, is speeding up the repair process. So if there's inflammation, there is likely a little bit of damage that's been done to the sheath, and your body's working to repair that damage, and red light therapy can speed that process along. So as little as 5 to 10 minutes of treatment time can have a carryover effect for 2 to 3 days following the treatment. So massive benefit. I'm going to put a link here for a video that I did that talks all about red light therapy. If you haven't looked into that, I strongly recommend that you do so. So there you have it. 3 strategies for addressing that trigger finger, and 4 actually if you count decreasing the insult if it's related to those gripping, grasping, or mousing activities. Question number 2 comes from Robert. He says, do you have any exercises for improving the balance one loses with aging? Well, if it's okay with you, Robert, I'm going to take a slightly expanded view of this question and change the word exercises to strategies. So, to answer your question plainly, yes, exercises are very effective for improving balance, especially in aging populations. There was a 2015 study that was published in the journal Sports Medicine that looked at over 30 years of research. They included 23 randomized controlled clinical trials in their meta-analysis, and they found at the end of looking at all of this data that there are tons of different ways for improving balance. And all of these exercises, whether it was training in a pool or doing Qigong or Tai Chi type exercises or standing on one foot or traditional forms of balance training like working on a wobble board or an inflatable balance disc, they were all effective for improving 4 aspects of a person's ability to balance. And those aspects were to balance when standing, to balance when walking, dynamic balance, to be able to balance when somebody comes to knock you over and you know that it's coming, and to be able to balance when somebody comes to knock you over and you don't know that it's coming. So lots of different exercises were effective for improving all 4 of those. And there wasn't any one in particular in that study that stood out above all of the others. What they did find, however, was an optimal training frequency. So they found that training 3 times a week, 30 to 45 minutes at a time, over 11 to 12 week period produced optimal results. And there was some indication in that study that training with more frequency or having it last longer than that 11 to 12 weeks would have even produced better results. So my recommendation is to work balance training as much as possible into your daily life. If your balance is severely compromised, you can start out working your balance from a seated position. And a great way of doing this is just by sitting on an exercise ball. If you are very compromised, you can start out sitting on that exercise ball with your feet positioned far apart. You can even have a table in front of you if you need to help balance you. And then as you get better at balancing yourself and as those muscles become stronger and more used to performing that activity, then you can start taking your hands off the table. You can start walking your stance on the ball closer and closer and closer together, ultimately getting to the point where your feet are touching, and that requires a lot more activation of your balancing muscles. Eventually, you would want to work yourself into a standing position where you're working on one foot. Again, if your balance is compromised, you'd want to be close to a wall so that you could reach out if you need that extra support and you're not able to get your foot down in time. And then eventually you would want to work into bigger and bigger challenges where you go from, say, standing on a hard surface to standing on a softer surface that requires more balance and more muscular activation to keep you upright. And then you can even start working into inflatable discs or wobble boards. And then you really want to start working into higher order balancing tasks where you're, say, marching back and forth or incorporating one foot standing into things like resistance training. Say you were doing a bicep curl at the gym, you could do it standing on one foot. Likewise with a tricep extension, standing on one foot, lateral raises, overhead presses, lots of different exercises where you could be incorporating 1 foot standing into that activity. We even had a Pain Fix Protocol community member who suggested brushing your teeth every day while standing on 1 foot. I love that idea. Or brushing your hair standing on 1 foot. So working it into your daily life, working on it multiple times per week for extended period of time is what's going to produce the best results. A couple other strategies that you should be aware of. Vitamin D supplementation. There have been multiple studies that show that seniors are at an increased risk for falling if they have low blood levels of vitamin D. And there was research out of Japan that indicated that simply by taking 700 to 1,000 international units of vitamin D3 every single day, you could decrease fall risk by 20%. So this requires very little effort, very little financial investment. Just take a high quality vitamin D3 supplement, about 1,000 international units a day, and you can get those phenomenal benefits. And then there is one other strategy that you definitely want to know about, and that's whole body vibration. These are these platforms that you stand on top of. The really high quality ones, they tend to push you in multiple directions. So you're talking about side to side, up and down, and even tilting from one side to the other. They're pushing you in all of those directions at the exact same time, so multiple times per second. And there's been research that shows that over an 18-month period, people who incorporated whole body vibration training into their balance training routine reduced their fall risk by 50%. And I've got a video where I talk all about that study and the results that those researchers produced, and you can see that video by clicking here. So there are 3 ironclad strategies for improving balance as you age. Question number 3 comes from Elaine. She says, "Hello, Dr. Whitten. I would like some advice. How do you make cartilage that has worn away through osteoarthritis in a hip joint? Thanks for your help." Elaine, this is an interesting question, and if you would have asked me the same thing 16 years ago, my answer would have been very cut and dry. I would have said something like, sorry, cartilage is one of the tissues in the body that does not regenerate. And once you've worn through it, you're kind of stuck. Now you're at the end of the spectrum where you're considering more invasive type procedures like a joint replacement to regain functionality. But since we're in 2022, the answer is a little bit more nuanced than that. And it's really dependent on where you are on the spectrum of osteoarthritis. So it turns out now that if you have some cartilage still present inside that joint, you may have some things to help you out. Now, starting at the simple end of the spectrum, the first thing to do is to preserve what you've got. So if you're working on improving the health of a joint, it's extremely, extremely important to maintain range of motion and functionality in that joint. So when you're working with a joint like a hip, it's a ball and socket, moves in many different directions. You need to find out where the movement restriction is and work on getting the motion or the functionality back into that joint. You may need to work with a practitioner for this to make sure that you do it efficiently and safely. But you'll want to check all the ranges of motion, flexion, extension, abduction, adduction, internal and external rotation, and then work on regaining motion in any areas where you're limited or restricted. Second factor is supplementation. Now, there are some really interesting supplement strategies that you should be looking at. One study that I would point at was published in 2011 in the journal Osteoarthritis and Cartilage, where researchers took a small group of people that all had osteoarthritic destruction of their knee joints, so like you, a weight-bearing joint in the lower extremity, and they had half of these people supplement with hydrolyzed collagen. It was like 10 or 12 grams a day, and the other group got a placebo, and they were given an MRI at the beginning of the study, and then they were re-MRI'd 24 weeks later. The group that was supplementing with hydrolyzed collagen had a measurable increase in the thickness of the cartilage lining that knee joint. So that's a pretty strong argument for being on a high-quality hydrolyzed collagen supplement over an extended period of time. Like I said, this study went on for 24 weeks. There's another supplement strategy that I'm a huge fan of, and that is blocking the enzymes that are actually responsible for cartilage degradation. That's right, there are a group of enzymes, most notably MMP, that actually go around and eat up cartilage, and these may be at the heart of the osteoarthritic process. Now, there are situations where traditional anti-inflammatories can be very beneficial and indeed necessary to help people recover. But those drugs do nothing for these enzymes that are actually eating up cartilage. In fact, they can actually accelerate cartilage degradation. I've got a video coming out on that in the near future, so stay tuned for that. But back to those MMP-like enzymes that are actually eating up the cartilage inside of joints. There are substances that have shown to be effective at actually inhibiting those enzymes and stopping them from eating up the cartilage. So you may want to work at it from that direction as well. So a few substances to look at here. There are certain kinds of pine bark extract that have shown to be effective for this. And then you can also look at substances like Boswellia serrata, and you should look at the old standbys, glucosamine and chondroitin sulfate, that don't get nearly the respect that they deserve. Glucosamine and chondroitin sulfate have shown in studies that have gone on for extended periods of time, like 8 years at a time, that supplementing with those on a regular basis can cut the need for joint replacement in weight-bearing joints of the lower extremity in half. So in my opinion, those are substances that everybody should be looking at. Pine bark extract, Boswellia serrata, glucosamine and chondroitin sulfate on a regular basis over an extended period of time to help protect the integrity of your joints and your ability to move into your later years. And then the final thing that you should be looking at, which is very interesting and has only come onto the scene in the last few years in a major way, is stem cell therapy. Now, I just interviewed a member of this community who had extreme osteoarthritic degradation of both of her knees, and she had incredible results. She went from a stage 4 osteoarthritis in both of her knees to a stage 2 after a single stem cell therapy treatment. She had measurable improvements in joint spacing and the thickness of her cartilage just within 9 months of having her stem cell therapy. So I did an interview with her, and if you're interested in seeing that, you can click the link here. Question number 4 comes from Linda. She says, "Thanks for this opportunity. My daughter broke her collarbone when she was about 10 years old. Came off a horse, was professionally seen, now 26. She still has tenderness and occasional discomfort in the area. Is this normal? If it was x-rayed again and found perchance not to have set properly at the time, can anything be done? Good luck with the inundation of questions I'm sure you will receive." Thank you for that, Linda. Back to your daughter. It sounds like she fell or was thrown off of a horse about 16 years ago, and she received medical treatment at the time. What I don't know is, what kind of fracture was it? Was it a simple fracture where they just put her in a sling and allowed it to heal up on its own? Or was it a very traumatic fracture with displacement that required hardware and screws to be installed to allow it to heal? So since I don't know, I'll answer both ways. If it was a very traumatic fracture, like broken in multiple places and she needed plates and screws to hold things in place, and those plates and screws are still there, it's very possible that those things are contributing to her tenderness and occasional discomfort. I've seen situations in the clinic where people who had hardware installed after a traumatic injury, it was creating problems in them years after the fact. And in some of those cases, those patients went back to their surgeons and asked them if they were far enough along in their healing process that the hardware could be removed. Some of those patients did very well after having their hardware removed. Now, truth be told, I've also seen plenty of patients who have had hardware installed and it created no problems over an extended period of time. So that may be something that you'd need to check with your surgeon on if your daughter is in that situation where she had hardware installed following the fracture. Now, if it was the more common garden variety fracture and she was just placed into a sling over an extended period of time, and which allowed that fracture to heal up, then I would submit that the assumption that's baked into this question that the tenderness and occasional discomfort is due to the fracture. Instead, I would submit that being in the sling for an extended period of time may have created some adhesions or allowed the buildup of scar tissue or contracture of the tissues that cross that shoulder joint that she never properly rehabilitated, because oftentimes they won't even rehabilitate a 10-year-old because they just figure, they're so young, they'll get through it. But what I would do is take her to a professional in your area who's qualified to assess the range of motion, functionality, and muscle quality in the tissue surrounding the joint on the affected side, and check the neck as well and make sure that everything is functioning properly. If it's that option there where she was in the sling for an extended period of time, I suspect you will find the answer that you're looking for in a proper assessment of that shoulder joint. Make sure that she's got full range of motion in all ranges. Make sure that that joint can do everything on the affected side that it could do on the side where there was no fracture, and make sure that the strength is equal on both sides. Oftentimes you can just train people out of these things through proper rehabilitation. So find a practitioner in your area who's qualified to assess a fully healthy shoulder joint, and then make sure that the side that was fractured falls into that classification. If it doesn't and there's any limitation, working her way through that with a rehabilitation process will most likely help to get rid of the occasional discomfort that she's experiencing. That's all for this week's episode of Ask Me Anything. If you guys enjoyed this, make sure to click the thumbs up button and subscribe to the channel so that you're updated when the next episode comes out. And if you want to get your questions answered, send them over to email support@painfixprotocol.com. Use the email subject line Q&A. If you don't use that subject line, I might not see your email. So send those questions over, and I'll see you next week.